My name is Ashley Parker, and this is my informative speech for Mr. Alatorre's Communications 181 class, and it's about acute lymphocytic leukemia. Imagine for a moment back to a time when you were sick, really sick. Maybe you had the flu, but this time isn't like every other time. This time, the doctor tells you that he wants you to stay overnight in the hospital to run some extra tests on your blood work. No problem. You feel terrible, but the doctor will give you some medicine for the flu or whatever nasty bug you picked up, and in a few days, you'll feel fine. The next morning, the doctor comes in and says to you, you have leukemia, but we're not sure what type it is, so we need to do a bone marrow lab. What? When? You ask him. Right now. There are no words to describe that moment. That moment of fear and confusion, disbelief, and sadness. Leukemia is not just any kind of cancer. It's a cancer without a cause. There is nothing that you could have done to keep yourself from getting it, and there was nothing that you did that caused you to get it. It does not run in families, nor does it discriminate against race or gender. And I can give you this type of first-hand account because I have watched someone who is near and dear to me survive this life-changing illness. My mother was diagnosed with acute lymphocytic leukemia on October 15th of 2008. Acute lymphocytic leukemia, or ALL, is cancer of the blood. And normally, when blood cells are developed in the bone marrow, they can become one of three types of cells. They can become red blood cells that carry oxygen to your body. They can become platelets that clog up cuts and injuries that we have. Or they can become white blood cells that fight infection. White blood cells can become three types of white blood cells. They can become monocytes, granulocytes, or lymphocytes. And for our purposes today, I'm just going to be talking about the lymphocytes. Even though leukemia cells can result from any of the blood-forming cells. The easiest way to explain ALL to you is simply by breaking down its name. In acute lymphocytic leukemia, the acute portion, it refers to the fact that ALL is a fast-growing cancer. If ALL is not discovered and treated, then the patient will most likely be dead within a couple of months. Hearing how close they were to death when they discover that they have cancer is usually a hard pill to swallow. Lymphocytic refers to the lymphocytes that I talked about earlier. According to the American Cancer Society, acute lymphocytic leukemia begins from an early form of these cells. And once these cells become leukemia cells, they grow and divide and make more cancer cells. And since that begins in the bone marrow, then they can spill over into the bloodstream and go to other parts of your body, other organs, and usually the nervous system and the brain. The word leukemia can be then broken down into two portions. The prefix, leuc meaning white blood cells, and emia meaning a cancer. So in other words, acute lymphocytic leukemia is a fast-growing cancer of the lymphocytic white blood cells. The main reason lymphocytic cells are so bad in ALL is that they are in immature form of the lymphocytes, and they live for far too long. As they continue to split, they crowd out the mature cells, the normal cells, and then the normal cells die off, and what you're left with is a bloodstream full of cells that can't fight infections for you. Based on statistics printed by the American Cancer Society, there were 5,330 new cases of ALL in 2010. 1 out of every 3 of these were adults. There were 1,420 deaths from ALL, and 3 out of 4 of these were adults. And if you think that this could never happen to you, here's another statistic for you. About 1 in 1,000 of you are going to get ALL before you pass away. Since ALL can again be broken down into many forms, it is hard to give you a solid number for survival rates, but as reported by the ACS in general, about 80 to 90% of adults will have complete remission after treatment. That means that leukemia cells can no longer be found in their bone marrow, but in about half of these patients, the cancer will come back. So the overall cure rate is around 30 to 40%. You can learn more about ALL from the American Cancer Society's website at www.acs.com or read my mom's full story at www.carrieandbridge.com/Vivian Fain. Turn it around so you can see my audience real quick.